Great. Well, thank you, everyone who has joined so far. I am Annika Izagiri. I am Communications Director with the Committee to Protect Healthcare. We appreciate you joining us today on a very busy day leading up to Election Day to hear from physicians who are urging former President Donald Trump to share his actual plan for the Affordable Care Act while he is rallying in Las Vegas later today. As our media advisory that you should have received noted, we are also backing a mobile billboard that is circling the venue with that message. And that will be running today from 12 to 8 p.m. Pacific time. So keep an eye out for that. And if you did not get the picture of that, I'm happy to send that to you as well. Um, before we begin, I would like to please note that these physician speakers are speaking as individuals and not necessarily on behalf of any employers or other organizations with which they're affiliated. So we ask that you please only refer to them in your coverage as they introduce themselves on this call. Thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Cully.
Hello, I'm Dr. Laura Cully, and thank you all for joining us today. I've been practicing internal medicine for over 30 years, first in New York City, and then in Las Vegas since 1989. I've done private practice, free clinics, community health clinics, pop-up clinics. Most of my work now and for the last 15 years has been with our populations that have no insurance, and there's a lot of them here. I'm also the founder of the Mobile Health Collaborative, which is an association of safety net clinics, health insurances, nonprofit organizations, nurses, physicians, health students, over 100 members that are committed to delivering health care to the uninsured out in their own communities. Today, we are here to ask, to urge, and to challenge former President Trump to clearly lay out at his rally what he plans to do about the Affordable Care Act. The ACA wasn't and still is not perfect, but it does attempt to provide a path for all Americans to get coverage, and it creates a number of policies and programs that are geared to improve the health of our country. There are less than 2 weeks until Election Day. Donald Trump has been running for president for nearly 10 years, but he has only offered that he has concepts of a plan for how he would change the Affordable Care Act, which he's been fighting for over a decade, and that he can't share these concepts except to say that they'll be really great, terrific, like you wouldn't believe, and much better than ACA. Well, during the 4 years of presidency, Mr. Trump supported numerous unsuccessful attempts by Congress to repeal the act. And when that failed, he pressured policymakers to defund and overturn as many of the policies written into the act as possible. His efforts resulted in an attempt to make Medicaid dependent on an agreement to work or attend school, an increase in the cost of premiums for the health exchange policies, a decrease in federal assistance to people as subsidies to cover the premiums, and he allowed the substitution of skinny temporary health policies that did not provide adequate coverage in a number of mandated areas. So he's been working to undermine this act rather than approve and strengthen this act. The Affordable Care Act is crucial to healthcare and Americans today. Thanks to the Affordable Care Act, Nevadans with pre-existing conditions can't be denied health coverage or charged more by insurance companies just for having these conditions. The ACA allowed Nevada to expand Medicaid, allowing more families who make too much for traditional Medicaid but not enough to afford private insurance finally get health coverage. Because of the ACA, young Nevadans can stay on their parents' health insurance until they're 26. As they get their education or start their careers. When I was working in our free clinics and community health centers, our patients have no insurance or inadequate insurance. I saw the everyday consequences of thousands of families without coverage. Before the ACA, I had families with 5 or 6 people, including grandparents, sharing one bottle of pills for a month for hypertension and diabetes because only one person had insurance. It was demoralizing. It was unimaginable. And even though people talk about people without insurance, you have to really see it to believe it, that that sort of situation is going on in our country. So when I hear that President Trump wants to change the ACA, but only has concepts of what to do, I get really concerned for my patients and for all of the patients in our country that don't have enough financial support to be able to shop around for the coverage that they want. It's not just the patients that are affected. In a state with severe shortage of physicians, the more people who use the emergency room for primary care problems, and the more people who are not treated until their illness is unmanageable, the higher the medical costs for everyone. Hospitals have to get the money back that the uninsured isn't paying by raising the prices for others. Without the repeal attempt, Trump just set his sights on chipping away at the ACA in other ways, and there's no reason to believe he won't do it again. That's why over 1,500 physicians across the country, which we represent today, have signed a letter demanding that the ACA plan the former president, that he come out with a plan and specifics. What will he do? What will he do for all of the people that are uninsured? What will he do for the people who have pre-existing conditions? We want a president who will make decisions based on what's best for Americans, not that he will show that he has the power to undo legislation as well as create it. That's why we have a mobile billboard running around the rally venue, and we want to remind voters that we deserve a plan. Our patients deserve a plan. And I think that we have to hold him accountable to that and not just have him wave it off. Thank you very much again for coming and listening to us. And now I'd like to introduce my colleague, Dr. Chang.
All right, thank you so much. My name is Kenny Chang. I'm a board-certified emergency medicine physician right here in Las Vegas. I'm also a dedicated core faculty member and director of clinical education for one of our local emergency medicine residency programs. So as ER doctors, it has always been our mission to not only take care of the most vulnerable and underserved populations here in Southern Nevada, but to also educate and inspire the next generation of physicians. I'm not a Democrat, I'm not a Republican, I'm not a politician. I'm simply an ER physician and citizen of Las Vegas who wants to keep this community and its people safe and healthy. So as Dr. Cully wonderfully shared, doctors like us are deeply concerned about what a second Trump presidency could mean for our patients' access to affordable healthcare. Very well known. While he claimed in September he wanted to improve the ACA and had, in quotes, concepts of a plan, former President Trump also just said earlier this year that, in quotes, Obamacare is a catastrophe. Nobody talks about it. You know, without John McCain, we would have had it done, end quote. So what would repealing the ACA mean for Nevadans? 31,000 Nevadans would see higher premiums. They see these premiums go up by an average of 5,300. And at least 487,000 people in Nevada with pre-existing conditions could lose their critical protections. 432,000 Nevadans' health insurance coverage would be at risk, including the more than 96,000 who get coverage through the ACA marketplace, and the more than 336,000 enrolled in Medicaid expansion coverage. So repealing the ACA, as Donald Trump has tried to do multiple times and would probably try to do again, would mean less healthcare and higher healthcare costs for patients like ours. And the ACA isn't the only law helping patients that Trump has threatened. Former President Trump has also made it very clear that he wants to repeal the Inflation Reduction Act. This law, which Vice President Kamala Harris helped pass, has resulted in huge healthcare savings for seniors. The Inflation Reduction Act finally gave Medicare the power to negotiate drug prices. Now 10 common prescription drugs cost less, and Medicare will continue negotiating prices for other drugs. This act also capped monthly insulin costs for seniors at $35 per month, and prescription drug costs for seniors at $2,000 per year. So these are huge steps towards ensuring all Nevadans and all Americans can afford prescription drugs they need to live. It's very simple, but it's very true. When patients can afford their prescriptions, they simply do better. They're better able to manage their chronic health conditions. This helps lessen symptoms and keeps their complications at bay. And when patients cannot afford their prescriptions, their conditions worsen unnecessarily. They end up in our emergency room when this could have all been prevented. This is sad, and this breaks my heart every day. Just in my last shift and the shift before, many people come in for medication refills because access to care is still truly an issue. And let's talk about even the worst case scenarios. And these are all very real. I've seen it every day. Talking about people that get heart attacks, strokes, diabetic emergencies, and people end up in the intensive care unit or even end up dead. And this is why doctors like us are speaking out. We deserve leaders who will protect and build on the ACA and the Inflation Reduction Act, not rip away affordable healthcare. And thank you so much for your time. And now I'll introduce Dr. Kooch.
Hello. Hi, my name is Dr. Sandra Kooch. I'm an obstetrician gynecologist and have lived and practiced in Carson City for over 30 years. I am committed to the goal of high quality, accessible, and affordable healthcare for all Nevadans. I also chair the state's Maternal Mortality Review Committee, which reviews maternal death to identify changes our state could make to reduce maternal deaths in the future. As my colleagues have mentioned, we have grave concerns about what former President Trump's stances on the Affordable Care Act and the Inflation Reduction Act could mean for our patients' ability to afford health care and prescription drugs and contraception. As an OBGYN, I'm also concerned about what his stances could mean for my patients' ability to access reproductive health care. The Affordable Care Act has helped more women gain access to reliable contraception, maternity care, and postpartum care. These are crucial aspects of reproductive health care and can be unaffordable and unattainable to many without the protections of the ACA. Having access to long-term reversible contraception is even more important when access to abortion is limited. Thankfully, right now in Nevada, abortion access is protected. We hope it stays that way and that those protections are strengthened even further this year by voters. But a national abortion ban would supersede any state protections. And former President Trump has indicated multiple times over many years he would sign a national abortion ban. He may be trying to soften his stand on abortion access lately, but we can't forget that he bragged many times about overturning Roe v. Wade. The 3 Supreme Court justices he appointed were instrumental to overturning Roe v. Wade and taking away the federal right to abortion. That action led to the state abortion bans we see today, which are causing real harm to women in states across the country. Many have heard the tragic story from Georgia of Amber Thurman, a 28-year-old mother who died after doctors delayed necessary care due to the state's ban on abortion. Women are suffering, their fertility is jeopardized, and some are dying because of state abortion bans. The same state abortion bans Trump is proud to have allowed to come into being. My colleagues on this call across Nevada and across the United States worry deeply about what a second Trump presidency would mean for all aspects of healthcare for our patients, from prescription drugs to preventative care to reproductive health care. Our patients and voters deserve real plans from the former president as he visits our state today. I look forward to hearing that from him. Thank you.
Thank you so much, Dr. Kooch. Dr.